Chapter 45, Part 5. Care of patients with cognitive, sensory, or communication impairment. Developmental disabilities. Defined by the CDC as a diverse group of severe chronic conditions due to mental and/or physical impairments. Usually these impairments appear prior to age 22, and usually they continue throughout the lifetime. There can be many attributes that may be adversely impacted, such as communication, movement, learning, behavior, ability to care for oneself, or prospect for employment. Profound vision or hearing impairment can disrupt other developmental issues as well, leading or contributing to a developmental disability. Certain conditions have uncertain causes, such as autism. A developmental delay is an infant's or child's failure to reach a particular developmental milestone by the expected time, including gross and fine motor skills, crawling, walking, hand-eye coordination, cognitive skills such as reaching, object permanence, and problem solving, and social skills such as interactions with others, forming relationships with others. Also, language milestones such as talking, listening, or comprehending. Signs of problems may be in one developmental area or in multiple areas. Delays are linked to many causes of developmental disabilities. Down syndrome and autism are associated with potentially significant developmental delay signs. Depending on causes, the delays may persist into adulthood, resolve as a medical or social situation improves. Early intervention is important and may allow children recovery of previously missed milestones. Cues from the patient and caregiver can help determine the best way to interact and communicate. Approaches used while treating younger children may be useful when dealing with older children and adults who are developmentally delayed. They may need additional time while assessing the patient, performing procedures, or preparing for transport. You want to make sure that you include these patients and never just assume that you have to treat an adult with a developmental delay as a child, but you need to find the appropriate way to communicate with the patient. So the first one we're going to talk about is Down syndrome. It is an inherited genetic disorder which is responsible for developmental delay, cognitive impairment, and you will notice that many of the Down syndrome patients, they have a pattern of unusual physical features such as a flattened face and nose, a short neck, upward slanting of eyes, a protruding tongue, and a single crease on the palm of the hands. They have very distinct facial features. Down syndrome is also known as trisomy 21. In Down syndrome, an extra chromosome attaches to the 21st pair, the third chromosome 21, or trisomy 21. Normal human cells have 23 pairs of chromosomes. A Down syndrome person actually would have a third chromosome attached to the 21st pair. Certain risk factors include siblings or mother with Down syndrome, older maternal age at time of conception, many different chromosomal changes that may be caused, structural heart defects, seizures, numerous gastrointestinal problems, speech alterations, hearing loss, and several other abnormalities as well. Also, the life expectancy is often shorter, and you may see a range of cognitive defects or deficits from barely noticeable to profound impairment. May function relatively independently or require constant assistance with basic tasks. An intellectual disability is a cognitive disorder appearing during childhood, accompanied by a lack of adaptive behaviors, including ability to live and function independently, interacting successfully with others. A diagnosis of intellectual disability requires that the patient have deficits in the areas of general mental abilities and adaptive functioning. These deficits are present before the patient is 18 years of age. A variety of tests are available, but intelligence quotient, or IQ, 65 to 75 is generally a defining characteristic. Clinical presentation and symptoms severity varies dramatically. Moving on to autism and autism spectrum disorders, this has a wide variety of the types of patients that may be involved. I can assure you, though, that autism is not developed from vaccinations. This has been debunked time and time again. These are conditions involving developmental delay and characterized by difficulties in social interaction, repetitive behavior, difficulties with verbal and nonverbal communication. There has been increased rates of diagnosis in the United States, possibly due to better awareness and screening, or it could be an actual increase in occurrence. Oftentimes, the patients will have issues with social interaction, communication. Sensory issues also are a big part of the autism spectrum. Ability to purposely shift attention, or even the ability to play with other children. The patients may be completely nonverbal throughout their lifetime or during periods of stress. Also, you may see patients with developmental regression with no other cause, and this should raise concern. The cognitive function varies significantly with autism and autism spectrum disorders. You've got patients that are autistic that are completely dependent on others, and then you've got people that have a form of autism or on the autism spectrum that are completely independent. Some have impaired cognitive function, meeting the criteria for intellectual disability, and some have savant-like abilities in mathematics, puzzles, memory, or art, meaning they're good at one thing but struggle in other areas. When treating patients with autism, be extremely careful while attempting to communicate or initiate physical contact. These patients may react bizarrely or aggressively to the commotion and excess stimuli. Physical contact should be preceded with careful explanation, done from distal to proximal, and questions to the patient should be repeated in a variety of ways to ensure consistent response. Patient may show minimal reactions to pain or great discomfort to minor physical contact injuries. It is helpful to include caregivers in assessment, treatment, and transport. Mental or emotional impairment. Patients demonstrating conversion disorder or hysteria may be particularly challenging. Patients may present with focal neurologic abnormalities from stress that manifest physically, such as blindness, paralysis, or impaired speech. Manifestations are not voluntary, and the patient is not faking the signs and symptoms. This is where compassion and empathy is going to have to come in. Diagnosis and treatment are beyond the scope of EMS personnel. If you suspect this disorder, maintain professional demeanor and continue to assess for other causes of the signs or symptoms. Hearing impairment. Different types of hearing loss can be congenital or acquired. Issues with hearing loss are communication, limit social interaction, may interfere with development of the infant, and may not be able to hear safety and warning devices. Genetic factors cause 50% of congenital hearing loss in children. The remaining 50% of congenital hearing loss is caused by factors including maternal infection, RH incompatibility, hypoxia, maternal diabetes, and pregnancy-induced hypertension. The majority of acquiring hearing loss is from excessive exposure to loud noise. The sirens. Various infections, tumors, ototoxicity from many medications, Meniere's disease, or degenerative processes of aging. You've got conductive hearing loss, which is the inability of sound to travel from the outer ear through the inner ear. Sensory neural hearing loss, problems with uptake of sound through tiny hairs within the ear and subsequent conduction of nerve impulses. Can be either type of loss or a combination of the two. Then you have central auditory processing disorder, an auditory process deficit characterized by difficulty interpreting speech when background noises are present, or auditory neuropathy or auditory dysynchrony, a condition with normal function of ear structures without a corresponding stimulation of auditory centers of the brain, linked to prematurity, other congenital abnormalities, and other neurologic conditions. Use of sign language or written words to communicate could be very helpful if you know how to do that. Cursory sign language may be very helpful to EMS personnel. Writing on notepads or electronic devices can assist paramedics in communicating with hearing impaired patients who can read and write. If patients have minimal or partial hearing loss, slow, deliberate, and repetitive speech can help with communication. You have different types of hearing aids, and you should be aware of these. You have behind the ear, the conventional type. You have partly in the canal and completely in the canal. You have in the ear aids, and you've got implantable hearing aids. These are all examples of different types. If you must insert a hearing aid, follow the natural shape of the ear. The hearing aid needs to fit snugly without forcing it. If there is a whistling sound, it may not be in far enough to create a seal, or the volume may be too loud. Reposition the hearing aid, remove it, and turn the volume down. If after 2 tries the hearing aid cannot be made to fit properly, place it in the box. Take it with you on transport and document the transport and transfer the hearing aids to hospital personnel. Don't try to clean the hearing aid or get it wet. Troubleshooting a problem with a hearing aid may include making sure it's turned on. Try a fresh battery and check that the tubing is not twisted or bent. Check the switch to make sure it's set on M for microphone. If it is a body aid, try a spare cord. Check that the ear mold is not plugged with wax. Most importantly, when it comes to placing hearing aids in, just like anything else, try to let the patient or the caregiver take care of it before you try to mess with it. Visual impairment. Congenital causes include fetal exposure to cytomegalovirus, hypoxia during delivery, albinism, hydrocephalus, retinopathy of prematurity, diseases of the retina of the eye that do not involve inflammation, has been linked to high levels of supplemental oxygen given to infants during the neonatal period. This is why we always discuss in neonatal resuscitation and the care of the neonate that we do not give high flow continuous oxygen. Acquired causes could include trauma, cerebrovascular accidents, age-related macular degeneration, glaucoma, cataracts, uncontrolled hypertension, diabetic retinopathy, degeneration of the eyeball, optic nerve, or nerve pathway, or vitamin A deficiency in many developing countries. Impaired vision may also be from optic nerve hypoplasia, a congenital condition where the optic nerve fails to completely develop. Optic nerve atrophy may occur following a cerebrovascular accident, a brain tumor, certain toxic chemical exposure, trauma. A variety of other causes can cause this as well. It can present in several notable patterns. Hysterical blindness is an antiquated term for conversion disorder, as we mentioned earlier. Blindness is a physical manifestation of an extreme psychological stressor. Diagnosis and treatment are challenging. Acute angle closure glaucoma is a true ocular emergency. Suspect this in patients who exhibit sudden onset of unilateral eye or periorbital pain and visual changes. Prompt recognition and transport are imperative. Explain before physically contacting patients with profound visual impairments. Warn patients before palpating a body region or performing a procedure such as starting an IV line. Discuss with the patient any needed movement or transport before doing so. Impaired speech may be associated with neurologic injury, toxicologic injury or exposure, anatomic abnormalities of the face or neck, or numerous other conditions. Speech impairment is divided into disorders impacting articulation, which is involving forming particular words or sounds. Lisps or trouble with specific sounds would fall under articulation. Voice production, which alters the pitch, the volume, or the tone of voice. Voice sounds may be muffled, raspy, or unusually high or low. Fluency. The speech patterns are affected. Unusual pauses or patterns of speech, prolonged repeated or avoided words or phrases. And language. Impair the manner that ideas, thoughts, and feelings are expressed or understood. The patient may cognitively understand what he or she wants to say, but cannot decide which words to use or phrases to use. Other speech disorders, language-based learning disabilities, phonologic process disorders, semantic pragmatic disorder of speech, dysarthria, and apraxia. Patience and deliberation when communicating with patients who have speech impairment is going to be very important. You may need to enlist the help of the family and the caregivers, but most importantly, you've got to show some empathy and understanding. Moving on to paralysis, paraplegia, and quadriplegia. So we know paralysis is the inability to move. There's many conditions that can cause paralysis. Usually it's caused by trauma to the neurosystem. You've got different types. You've got paraplegia, which affects the lower extremities, and quadriplegia, which affects upper and lower extremities. Often accompanied by sensory deficits and loss of bowel or bladder control. Serious issues do occur, such as respiratory muscle paralysis. In this case, patients will most likely be completely dependent on a mechanical ventilator or a similar device. Pressure ulcers. Anybody that stays in the same position for a long period of time will end up having tissue breakdown. Frequent position changes are needed by either mechanical devices or caregivers. There are beds that actually shift every 2 hours. You can program them to relieve the pressure off of the tissue. You've got tissue perfusion to the coccyx and other bony prominences cause pressure sores with external pressure applied for long periods of time, and then the patient can become infected, which can significantly cause mortality. Autonomic dysreflexia. So this is something that you may see, and it is something that can be a little bit nerve-wracking in the field. Basically what's happening here is that the patient's catecholamines are being released unrelenting, and it creates an increase in central nervous system action and the autonomic nervous system action. This is a risk for patients with paralysis from spinal cord injury. A body stressor triggers a release of catecholamines from the autonomic nervous system. When you're thinking about body stressors, it could be something as simple as a wrinkle in the sheet that's under them. And basically what's happening here is that the body just cannot interpret what the stressor is, and so it automatically relates it to being a big deal, and so it causes a release of the catecholamines, the fight or flight response. This causes vasodilation above the spinal cord injury and massive arterial vasoconstriction. This is going to cause dangerously high blood pressure. So if you've got a patient that is paralyzed and you go to them and you see that they've got a dangerously high blood pressure, you've got to think autonomic dysreflexia, which is a true medical emergency. The first thing you got to do is remove the stressor from the patient, and then they should be transported to the hospital for evaluation. External devices such as halo rings or vests are often used to stabilize the structures of the spine, require additional consideration and coordination during movement of the patients. The patient who experiences paralysis, whether it's paraplegia or quadriplegia, are susceptible to environmental extremes. It's often impossible to regulate perfusion to the skin. Fluctuations of the autonomic nervous system cause risk for both hypothermia and hyperthermia. Again, remember, the central nervous system is affected and the patient is not going to be able to thermoregulate as a normal person would. There's not always a loss of sensation. The patient may have normal sensation or even hyperesthesia, increased sensitivity. Conversely, pressure that would be felt normally may not register. Some male patients with severe spinal cord injury will have priapism, a prolonged penile erection, not related to sexual arousal. Many patients require urinary catheterization. If regular bladder emptying is not done, the following can occur: urinary infection, urinary reflux, or this could be a stressor that causes autonomic dysreflexia. Total lifting assistance is usually required. May or may not need additional lifting assistance regarding other devices, such as a tracheostomy tube, indwelling urinary catheter, a colostomy, or a ventilator, to name a few. So moving to trauma in cognitively impaired patients. Most impairments will be problematic during a traumatic event. Isolated sensory or communication impairments can cause additional anxiety, confusion, delays, or disruption of patient care or transport. Patients with severe cognitive impairments may also present with abnormal behavioral responses. You may need to modify your communication, your assessment, your intervention, or your transportation. Effective communication may not always be impossible. If a caregiver is not available, rely on physical or behavioral cues of the patient. Medical treatment consent may be uncertain. Adults with profound impairment may not have decision-making capacity, consent to, or refuse medical treatment. You may need to locate a valid surrogate decision-maker. Initiate treatment under the doctrine of implied consent in emergency situations. Patient assessment techniques may need modification. Patients may present with educational levels at 6th grade or below. Patients may have difficulty understanding or communicating timing or relationship of events. The use of open-ended questions may give clues regarding the patient's cognitive ability and decision-making capacity. Have the patient paraphrase information back to the paramedic, especially when obtaining patient consent or refusal. Caregivers can be a valuable resource following a traumatic event by relaying how the patient normally communicates, the level of awareness or understanding, physical abilities, their motor skills or activity, additional information such as sleep patterns and eating habits. Consider allowing the caregiver to stay with the patient during the physical exam. Consider deferring vital sign measurements in patients showing sufficient oxygenation, ventilation, and perfusion until the patient is calmer or cooperative. Interventions may require additional time, explanation, and assistance. Management of traumatic injuries is generally the same as for other patients. Expect concomitant neurologic disorders such as seizures, delirium, weakness, or muscle spasms. Also common are psychiatric disorders, GI abnormalities, or chronic or frequent infections. Assess for and treat pre-existing injuries and check for signs of abuse and neglect. Quickly talking about other notable chronic medical conditions, cancer. Cancer refers to various conditions resulting from excessive growth and division of abnormal cells within the body. It is important to remember that no two cancers are the same, and the term cancer is just an umbrella term for many different disease processes that affect the cells in the body. Your typical treatment is radiation, chemotherapy, and surgical removal. Things that you may see: nausea and vomiting, anorexia, discomfort, or these patients may become immunocompromised. Patients often have implanted ports or other long-term vascular access devices so that they can receive chemotherapy, analgesics, blood product replacements, and other medications that may require frequent intravenous access. For patients diagnosed with or being treated for cancer, you may need to correct dehydration issues, administer pain or antiemetic medications, ask and inspect for transdermal patches before administering medications. Ask about the patient's wishes regarding resuscitation. If applicable, obtain copies of advance directives or DNR paperwork. Cerebral palsy is a non-progressive neurologic disorder from injury to brain tissue that may occur during fetal development, labor and delivery, or the first 2 years of life. Can be caused by genetic defects, maternal infections, fetal cerebral vascular accident or stroke, excessive fetal bilirubin or hemolysis, hypoxia before or during birth, or infant infection, postpartum encephalitis or meningitis, and head trauma. Cerebral palsy produces altered skeletal muscle function or contractions. The muscles are poorly controlled and may be unusually contracted, flaccid, or paralyzed. The severity ranges from almost unnoticeable or profoundly devastating with paralysis of arms and legs, severe intellectual disabilities. Those more severely affected may present with chronic signs and symptoms including seizure disorders, hearing loss, and a variety of other neurologic disorders. It may affect only certain body regions or the body overall. You may see hemiplegia, paraplegia, or a term spastic tetraplegia, which affects all 4 limbs. Movement disorders include tremors, an unsteady gait, or ataxia, or athetosis, involuntary writhing movement. Severe cases may present with seizures, loss of bladder control, inability to swallow, joint contractures, or impaired respiratory function. Careful movement and positioning during treatment and transport. Significant musculoskeletal changes may make assessment and safe movement difficult. Congenital heart disease in adults. This refers to abnormalities of the heart or great blood vessels that develop before birth. Often diagnosed shortly after birth, may escape detection for many years. The range of severity is from insignificant to immediately life-threatening. The patient, family members, or caregivers will likely understand the severity and implications of a particular condition. Significant physiological stressors such as pneumonia, pregnancy, or sepsis may unexpectedly complicate an otherwise stable chronic heart condition. Consider undiagnosed chronic heart disease when patients present with heart murmur accompanied by signs and symptoms of heart failure. Cystic fibrosis is a genetic disorder characterized by increased mucus production in the lungs and digestive tract. It is caused by a defective recessive gene inherited from each parent that makes it difficult for chloride to move through cells. It causes unusually high sodium loss. Mild cases are often undetected until adulthood. It may also affect other body systems or organs. Sweat glands, reproductive glands. Increased mucus may impair respiration, disrupt food digestion, and become a life-threatening emergency in severe situations. It is suspected in newborn infants who present with meconium or odd-smelling or odd-appearing stool, usually pale, greasy-looking, and foul. There is a list of GI symptoms. We mainly think emergency type pulmonary manifestations such as pneumonia, pneumothorax, cough, respiratory distress, or respiratory failure. The big issue with cystic fibrosis with the pulmonary system is that there is just a large amount of thick mucus and the patient is not able to expectorate it, and it gets stuck and it can end up causing pneumonia and it can end up causing obstruction. Other symptoms include malnutrition and poor growth rate, failure to thrive, infertility, chronic sinus congestion, also bone mineral loss. Sometimes you may see long-term vascular access devices for frequent or continuous IV antibiotic treatment in these patients. Also, devices promoting lung function and removal of mucus. And they also may be on intermittent or continuous home oxygen. Patients may have a long, complex medical history and many clinical abnormalities. Patients may require additional assessment time. Patients may have minimal to profound respiratory or GI compromise. Expect to administer oxygen, provide frequent deep suctioning, assist ventilations, and possibly even provide hydration. Usually diagnosed in infants and children. Specialized tests are required for diagnosis, and of course we will not make a diagnosis of cystic fibrosis in the field. Multiple sclerosis is a severe incurable degenerative disorder involving the brain and spinal cord. This is a demyelination disorder in which immune cells attack the myelin sheath of certain nerve fibers, preventing nerve transmission to other body tissues. The cause is unclear, but it seems to be connected to genetic factors, environmental factors, nutrition, and exposure to a particular virus. It strikes women in their 20s to 40s 2 to 3 times more often than men. It affects approximately 400,000 Americans, some with serious handicaps. The presentation typically includes problems related to muscle coordination, muscle tone, altered sensation, and gait disturbances. Neurologic signs and symptoms include all the following: problems with musculoskeletal system, clumsiness and ataxia, constipation or bladder incontinence, fatigue, decreased sexual performance, extremities feeling weak or heavy, altered sensations, numbness or tingling in the body, cognitive impairment, disruption of speech or swallowing, visual impairment, skin breakdown from immobility or poor posturing. There is no specific EMS treatment. You may need extra time for assessment. Supportive measures include IV hydration, analgesics, or muscle relaxing medications, careful patient positioning, and assisted ventilation when needed. Muscular dystrophy is a category of incurable genetic diseases causing a slow progressive degeneration of muscle fibers. Specific diseases can be diagnosed by certain genetic markers, age at time of onset, the rate of disease progression, and the gender of the patient in certain cases. Children may present with obvious facial muscle changes, altered gait, delayed psychomotor developmental milestones, and changes in posture. Severe manifestations of certain specific diseases in this group include cardiomyopathy, cognitive impairment, or respiratory compromise. Duchenne muscular dystrophy is the most common type. It's caused by sex-linked recessive gene, chiefly affects boys, characterized by enlarged heart muscle or dilated cardiomyopathy, heart dysrhythmias, scoliosis of the spine, gait disturbances, and the need to use a wheelchair by age 15. EMS treatment is primarily limited to positioning, supportive treatment, and assisted ventilation if needed. Myasthenia gravis is a rare autoimmune disorder, suddenly or gradually affecting neuromuscular transmission, causing the muscles to weaken and tire easily. It affects all ethnic groups and both sexes, although it is most commonly found in women younger than 40 years, typically between 20 and 30 years, men older than 60 years. Ocular myasthenia gravis is localized to the eyelids and extraocular muscles. Generalized affects respiratory muscles and a variety of skeletal muscles. Patients often have difficulty speaking, chewing, and swallowing. A myasthenic crisis is respiratory failure from respiratory muscle fatigue, occurring if the patient's respiratory muscles are damaged by infection, stress, side effects of medication, and menstruation. You may see drooping eyelids. They may report double vision, difficulty speaking, chewing, or swallowing. Muscle weakness in the extremities as well. May be called for complications of the disease or for unrelated issues. It is possible for symptoms to resolve with rest or during transient remission. Treatment is generally supportive and based on presentation. Myasthenic crisis may require airway protection and assisted ventilation. Myelomeningocele or spina bifida. Birth defect caused by improper development of fetal neural tube. A defect in the vertebral column causes an opening exposing the spinal cord and the meninges. The corresponding defect in the overlying skin exposes the spinal cord and meninges to the outside environment. May be accompanied by a negative impact on bowel and urinary elimination, scoliosis, or other orthopedic disorders. Surgical treatment usually occurs within 2 days of birth. Sometimes while the patient is still in the mother's uterus, it may even occur. 2 scenarios for EMS provider care. Pre-hospital delivery of the fetus. In this case, once the fetus is delivered, cover the smaller spinal cord openings with a moist sterile dressing. Cover larger openings with sterile occlusive dressing to prevent neonatal hypothermia. Place the patient in a prone or lateral position. Promptly transport the newborn to a facility specializing in critical newborn care. Other scenario may be infants, children, and adults who have already received surgical correction of spinal bifida who present with issues related to or completely unrelated to the disorder, likely to need careful positioning because of vertebral column and orthopedic abnormalities. Clinical manifestations include bladder dysfunction, scoliosis, neurologic conditions, complete or partial leg paralysis, or abnormalities of various bones or joints. Poliomyelitis or Postpolio syndrome. Poliomyelitis is a viral infection causing significant morbidity and mortality throughout the world. There was aggressive vaccination campaigns since the 1950s that have eradicated, hence the word eradicated, the polio virus in many countries, including the United States. Even without new cases, more than 650,000 live with the sometimes profound consequences of polio. Humans are the only known host. Polio initially presents with symptoms similar to viral syndromes, fever, sore throat, headache, malaise, vomiting. As it progresses, other symptoms appear, which include back pain, diarrhea, leg pain, continued fever, and muscle discomfort or stiffness. 2 types, non-paralytic and paralytic. With non-paralytic, recovery is complete. Paralytic, you have muscle weaknesses that evolves to paralysis of various muscles, muscle spasms, respiratory distress, drooling, or difficulty swallowing. Complications include hypertension, respiratory failure, myocarditis, shock, loss of intestinal function, and death. Postpolio syndrome. Survivors are at risk for postpolio syndrome, and they may see progressive or sudden worsening of muscle weakness previously caused by the poliovirus, muscle atrophy, renewed risk of respiratory insufficiency or respiratory failure, difficulty swallowing, impaired speech, or significant pain or fatigue. Long-term prognosis is favorable for subclinical polio or polio that did not involve the brain or spinal cord. Our treatment is going to be primarily supportive. Traumatic brain injury is going to be discussed in more detail in your trauma class. There's a wide assortment of disorders: congenital, emotional, behavioral, sensory, and communication. Patients may present with seizures, impaired movement, GI dysfunction, urinary retention, or paralysis. Be prepared to encounter patients with a wide range of impairments or complications. Location or severity may make assessment and transport difficult. Caregiver's assistance is often essential. So that wraps up Part 5 of Chapter 45. If you have any questions, please feel free to contact me, Nick Ray, at suscc.edu.